The RN is assigning tasks to a UAP. Which of the following is appropriate? A. Instructing the UAP to administer oral medication. B. Asking the UAP to feed a stable patient with dysphagia. C. Assigning the UAP to perform a sterile dressing change. D. Asking the UAP to perform a focused respiratory assessment. Answer: B. Feeding a stable patient with precautions is within UAP's scope. Sterile procedures and assessments are RN duties. A nurse is delegating tasks to an LPN. Which task is most appropriate? A. Developing a discharge plan. B. Evaluating a patient's pain relief. C. Administering 4 push medications. D. Monitoring a stable post-op patient. Answer: D. LPNs can monitor stable patients but cannot evaluate, plan care, or give 4 push meds. Which task must the RN complete personally and not delegate? A. Ambulating a patient after surgery. B. Suctioning a tracheostomy. C. Performing the initial patient assessment. D. Obtaining vital signs. Answer: C. Initial assessments and clinical judgments are RN responsibilities only. An RN is supervising a new LPN. Which action by the LPN requires intervention? A. Administering a subcutaneous injection. B. Listening to bowel sounds. C. Developing a teaching plan. D. Collecting a urine specimen. Answer: C. Only RNs develop patient teaching plans. Which of the following is the best example of effective delegation? A. Monitor the patient's heart rate for me. B. Check the blood glucose when you get time. C. Take vital signs every 4 hours and report anything abnormal. D. Assess the surgical site for signs of infection. Answer: C. Clear, measurable, and observable tasks should be delegated, not assessments. An RN is delegating to a UAP. Which instruction demonstrates appropriate delegation? A. Tell me if the patient looks uncomfortable. B. Document the patient's level of pain. C. Reposition the patient every 2 hours and report any skin redness. D. Interpret the patient's blood pressure readings. Answer: C. The task is within UAP's scope, and the instruction is specific, measurable, and includes follow-up. Which task is most appropriate for the RN to delegate to the LPN? A. Teaching a patient how to self-administer insulin. B. Developing a plan of care for a new diabetic patient. C. Administering a tube feeding to a stable patient. D. Interpreting a patient's lab values and adjusting care. Answer: A. LPNs can reinforce teaching but cannot plan or interpret lab results. An RN delegates to a UAP to assist with bathing. The UAP notices a skin breakdown and does nothing. The RN is responsible because A. The UAP should have treated it. B. The RN retained accountability for the patient's care. C. The UAP is licensed and responsible. D. The UAP should have reassigned the task. Answer: B. Even when tasks are delegated, the RN retains full responsibility for patient outcomes. The RN delegates blood glucose monitoring to a UAP. The UAP forgets. What is the RN's best action? A. Document the UAP's neglect. B. Report the UAP to administration. C. Reassign the task to another staff member. D. Re-educate the UAP and monitor future delegation. Answer: D. Corrective teaching is the proper action to ensure future safety and effectiveness. Which statement by the nurse demonstrates ineffective delegation? A. Let me know if the patient's heart rate is over 100. B. Check vital signs every hour and document them. C. Assess the patient's lung sounds and report back. D. Help the patient ambulate 3 times today. Answer: C. Assessment is a task only an RN should perform. Delegating this is inappropriate. A nurse is planning patient assignments. Which should be assigned to the RN? A. Routine catheter care. B. Initial post-op assessment. C. Assisting with meals. D. Ambulating a stable patient. Answer: B. Initial assessments require clinical judgment and must be performed by the RN. Which action is appropriate for a UAP? A. Providing wound care instructions. B. Assisting a patient with toileting. C. Changing a central line dressing. D. Giving a subcutaneous injection. Answer: B. Toileting is within the scope of a UAP. The others require licensed professionals. A nurse delegates measuring urine output to a UAP. Which is a priority instruction? A. Record at the end of the shift. B. Only report if the color is red. C. Report output less than 30 milliliters per hour immediately. D. Add all measurements after 24 hours. Answer: C. Urine output less than 30 milliliters per hour indicates a critical condition and must be reported. A nurse observes a UAP performing passive range of motion exercises incorrectly. What should the nurse do? A. Report the UAP to their supervisor. B. Reassign the task. C. Intervene and re-educate the UAP immediately. D. Wait until the end of shift to correct. Answer: C. Patient safety requires immediate action and correction of improper technique. Which of the following tasks can the RN not delegate to an LPN? A. Administering oral medications. B. Evaluating a patient's response to pain medication. C. Changing a simple dressing. D. Documenting fluid intake. Answer: B. Evaluation is a component of the nursing process that must be done by an RN. Which task should the RN assign to a newly hired UAP? A. Assisting with ambulation of a post-op hip patient. B. Monitoring for signs of internal bleeding. C. Teaching incentive spirometry. D. Evaluating pain control effectiveness. Answer: A. Simple assistance tasks are appropriate for new UAPs with clear direction. An RN assigns an LPN to monitor a patient receiving a blood transfusion. What is the best follow-up? A. No follow-up is needed. B. Ask LPN to assess the patient's lungs. C. RN observes the patient during first 15 minutes. D. Ask UAP to monitor for fever. Answer: C. RNs must monitor patients during the initial phase of a blood transfusion due to the risk of reaction. What should the nurse do before delegating a task? A. Ensure the task will take less time when done by someone else. B. Confirm the delegatee is capable and trained for the task. C. Choose the least busy staff member. D. Assign the task to the most junior nurse. Answer: B. Delegation requires consideration of skill, competence, and training. A UAP asks, "Can I adjust the oxygen flow rate?" What is the correct response? A. Only if the patient requests it. B. Yes, if the patient is stable. C. No, only licensed personnel can adjust oxygen. D. Only if it's under 2 liters per minute. Answer: C. Oxygen is a medication. Only licensed staff may adjust it. An LPN is assigned to care for a post-op hip replacement patient. Which task requires RN intervention? A. Reinforcing deep breathing exercises. B. Administering oral pain meds. C. Performing an initial neurovascular assessment. D. Assisting the patient to the bedside commode. Answer: C. Initial assessments must be performed by an RN. The nurse is assigning care. Which patient must the RN care for? A. Stable post-op patient on room air. B. Client with new onset confusion and fever. C. Client awaiting discharge instructions. D. Client with scheduled blood glucose test. Answer: B. New onset symptoms need RN assessment and judgment. A nurse assigned a UAP to bathe a patient. The UAP reports the patient is unusually drowsy. What is the RN's action? A. Ask the UAP to monitor vitals. B. Immediately assess the patient personally. C. Tell UAP to complete the bath and report back. D. Wait until rounds to check on patient. Answer, B. Change in condition needs direct RN assessment. Delegation is most appropriate when A. The nurse needs more time. B. The patient is unstable. C. The task does not require clinical judgment. D. The task is unfamiliar to the nurse. Answer, C. Only non-judgmental, routine tasks can be delegated. A UAP refuses a delegated task. What should the RN do? A. Reassign the task to someone else. B. Document the refusal and do the task. C. Discuss the refusal and re-clarify expectations. D. Report the UAP to HR immediately. Answer, C. Clarifying roles and expectations ensures safe delegation. The LPN reports increased swelling at a surgical site. What should the RN do? A. Tell the LPN to continue monitoring. B. Assess the site immediately. C. Instruct UAP to notify the physician. D. Document what the LPN reported. Answer, B. RNs must assess and intervene in potential complications.